From the chilling sight of plague doctors with their ominous bird-like masks, the Black Death has captured imaginations for centuries. Picture a disease so swift and unforgiving that people who felt perfectly healthy in the morning could be dead by nightfall. In October 1347, 12 trade ships from the Black Sea docked in Messina, Sicily, bringing more than just goods. Most of the sailors aboard were either dead or dying, covered in black boils that oozed blood and pus. Sicilian authorities quickly ordered the ships to leave, but the plague had already taken root. Over the next 5 years, it would claim more than 20 million lives, wiping out about 1/3 of Europe's population. The origins of the Black Death trace back to Asia, where it traveled trade routes through China, India, and beyond. Although often linked to trading ships, recent research suggests the plague's deadly pathogen, Yersinia pestis, may have existed in Europe thousands of years earlier. Whatever its ancient origins, medieval Europe was utterly unprepared for the horrors it unleashed. Italian poet Giovanni Boccaccio described the harrowing symptoms: painful swellings the size of eggs, fever, vomiting, and swift death. The disease attacked the lymphatic system, creating the infamous plague boils known as buboes. Contagion was terrifyingly swift. Touching infected clothing or merely breathing the same air could be deadly. Medicine of the time offered little help. Treatments like bloodletting and burning herbs were common, but ineffective. The true culprits, rats and fleas, spread the disease rapidly. Cities fell into chaos as fear took hold. People fled their homes, doctors refused patients, and even priests abandoned the dying. The Black Death didn't vanish entirely. It resurfaced for centuries. Today, modern medicine has tamed its threat, but cases still appear every year. The 1918 Spanish flu pandemic is considered the deadliest in history, with an estimated mortality rate between 10% and 20%, 50 to 100 million people worldwide. Unlike typical flu outbreaks that mainly affected children and the elderly, this virus struck healthy young adults as well as animals like dogs and cats. It spread rapidly at the end of World War I, with wartime censorship hiding its impact in many countries. Spain, being neutral, openly reported cases, leading to the misnomer Spanish flu. Some trace the outbreak's origin to a military camp in Kansas, where a cook, Gilbert Mitchell, was among the first recorded cases. Symptoms included high fever, fatigue, diarrhea, and respiratory distress, with many deaths caused by secondary pneumonia. The deadliest wave occurred between September and December 1918. Governments enforced hygiene measures, quarantines, and mandatory mask wearing to curb the disease. By 1919, immunity had developed in much of the population, and the pandemic faded, though its impact shaped modern public health responses. The Plague of Athens, which struck in 430 BC during the Peloponnesian War, was a devastating epidemic that crippled the city-state at its peak. Sweeping through the overcrowded population trapped behind Athens's walls, the disease spread with horrifying speed. Witness accounts describe sudden fever, inflamed eyes, violent coughing, and unquenchable thirst, followed by skin rashes, diarrhea, and ultimately death. Many victims perished within a week, some dropping dead in the streets, while others, abandoned by terrified relatives, succumbed alone in their homes. The historian Thucydides, himself a survivor, documented the chaos. Lawlessness took hold as people, certain they would die, indulged in reckless pleasures. Physicians, powerless to cure the disease, died in great numbers. While its exact cause remains debated, some theories suggest typhoid fever or Ebola-like hemorrhagic fever. The plague killed nearly a quarter of Athens' population, including its leader, Pericles, weakening the city's military and contributing to its eventual defeat by Sparta. The Plague of Justinian, which erupted in 541 AD, was one of the deadliest pandemics in history, decimating the Byzantine Empire at its height. It began in Egypt before spreading rapidly through trade routes to Constantinople, where it killed up to 10,000 people per day at its peak. Victims experienced sudden fever, chills, swollen lymph nodes, buboes, vomiting, and delirium. Many died within days, their bodies piling up in streets, overwhelming burial sites, and forcing mass graves or disposal into the sea. Emperor Justinian I himself contracted the plague but survived, though his empire suffered devastating losses. Agriculture collapsed, trade halted, and labor shortages weakened the economy. Some historians estimate the death toll reached 25 to 50 million across Europe, the Middle East, and North Africa. Thought to be an early outbreak of Yersinia pestis, the same bacterium behind the Black Death, the plague recurred in waves for over 200 years, hastening the Byzantine Empire's decline. The HIV/AIDS pandemic emerged in the late 20th century, reshaping global health and society. First identified in the early 1980s, HIV, human immunodeficiency virus, spreads primarily through blood, sexual contact, and from mother to child. Unlike other pandemics, it progresses slowly, attacking the immune system over years until it develops into AIDS, acquired immunodeficiency syndrome, leaving the body vulnerable to deadly infections. By the mid-1990s, HIV had spread worldwide, claiming millions of lives, with sub-Saharan Africa suffering the highest toll. The stigma surrounding the disease led to fear, misinformation, and discrimination against those infected. Early treatments were limited, but the introduction of antiretroviral therapy, ART, in the late 1990s transformed HIV from a fatal diagnosis into a manageable condition. Despite medical advancements, the virus continues to affect millions, with over 40 million deaths since its discovery. Today, global efforts focus on prevention, education, and treatment, but the fight against HIV/AIDS is far from over. The Antonine Plague, one of the earliest recorded pandemics, struck the Roman Empire between 165 and 180 AD, devastating its population and military strength. Believed to have been either smallpox or measles, the disease was brought back by Roman soldiers returning from campaigns in the East. Symptoms included fever, diarrhea, skin eruptions, and, in severe cases, death within days. The plague spread rapidly through the empire's vast trade and military networks, killing an estimated 5 million people, including Emperor Lucius Verus. At its peak, Rome lost thousands daily, crippling its economy and military. The famous physician Galen documented its horrifying effects but had no cure. Religious panic grew as people saw the plague as divine punishment. The Antonine Plague marked a turning point in Roman history, weakening the empire and foreshadowing future crises. Though it eventually faded, it left lasting scars, reducing Rome's population and shaking its political and social foundations. The COVID-19 pandemic caused by the SARS-CoV-2 virus emerged in late 2019 in Wuhan, China, before rapidly spreading worldwide. Declared a pandemic by the WHO in March 2020, it led to widespread illness, overwhelmed healthcare systems, and drastic global disruptions. Symptoms ranged from mild cough and fever to severe pneumonia and organ failure, with the elderly and those with pre-existing conditions at highest risk. Governments enforced lockdowns, travel restrictions, and social distancing to slow the spread. Hospitals faced shortages of ventilators and protective equipment, while misinformation fueled public confusion. Scientists raced to develop vaccines, and by late 2020, mass vaccination campaigns began. Beyond health, COVID-19 caused economic turmoil, job losses, and mental health struggles. The virus mutated into new variants, challenging containment efforts. Though vaccines and treatments helped regain control, the pandemic reshaped societies, emphasizing the need for preparedness, scientific cooperation, and resilience in the face of global health threats. The Coca-Cola epidemic, a devastating outbreak that struck Mexico in the 16th century, remains one of history's deadliest pandemics. Between 1545 and 1548, an unknown disease ravaged the indigenous population, killing an estimated 5 to 15 million people, up to 80% of those affected. The epidemic, named Coca-Cola, Nahuatl for pest or plague, caused high fevers, severe bleeding from the nose and eyes, jaundice, and intense dehydration, leading to rapid death within days. Unlike European diseases like smallpox, which had already weakened native populations, Coca-Cola struck with unmatched ferocity, particularly in drought-stricken regions. Modern research suggests it may have been an outbreak of Salmonella enterica, possibly spread through contaminated water. Spanish colonizers were largely unaffected, fueling fears that the disease was divine punishment. Repeated outbreaks followed in the 1570s, further decimating Mesoamerican civilizations. The Plague of Cyprian, one of the deadliest pandemics of antiquity, swept through the Roman Empire between 249 and 262 AD. Named after Saint Cyprian, a bishop of Carthage who documented its horrors, the disease struck at a time of political instability and economic decline, worsening the empire's troubles. Reports describe victims suffering from relentless diarrhea, vomiting, high fevers, and severe throat ulcers. Many succumbed within days, their bodies left in streets as death overwhelmed entire cities. Unlike previous plagues, this epidemic spread rapidly, reaching as far as Gaul, Egypt, and the eastern provinces. Historians debate its true cause. Some suspect smallpox or an early strain of Ebola, but its impact was undeniable. Rome's military and labor forces were crippled, weakening defenses and deepening the empire's crisis. Yet in the chaos, Christianity found an opportunity to grow. While pagans abandoned the sick, Christian communities cared for the afflicted, earning converts and strengthening their influence. Smallpox, one of history's most devastating diseases, plagued humanity for centuries, leaving a trail of suffering and death. Caused by the variola virus, it spread through respiratory droplets and contaminated objects, making it highly contagious. Victims first experienced high fever, headaches, and severe fatigue before the hallmark rash appeared, painful, pus-filled sores that covered the body, often leading to blindness or disfigurement. Mortality rates were brutal, killing up to 30% of those infected. Throughout history, smallpox shaped civilizations. It ravaged ancient empires, contributed to the downfall of indigenous populations in the Americas after European colonization, and frequently altered the course of wars. No cure existed, but in 1796, Edward Jenner's groundbreaking discovery of vaccination revolutionized medicine. By using cowpox to build immunity, he paved the way for the world's first vaccine. After centuries of outbreaks, the relentless global vaccination campaign led to a historic victory. By 1980, the World Health Organization declared smallpox eradicated, making it the first disease wiped from existence. Malaria, an ancient and persistent killer, has plagued humanity for millennia, shaping the course of civilizations and claiming millions of lives. Unlike pandemics caused by viruses or bacteria, malaria is a parasitic disease transmitted through the bite of infected Anopheles mosquitoes. Symptoms include fever, chills, sweating, severe headaches, and in extreme cases, organ failure and death. The disease thrives in tropical and subtropical regions, making Africa, South America, and parts of Asia its most affected battlegrounds. Historically, malaria altered wars, weakened empires, and devastated entire populations. It played a role in the decline of ancient Rome and severely impacted soldiers during both world wars. For centuries, quinine, derived from the bark of the cinchona tree, was the only known treatment. In the 20th century, synthetic drugs like chloroquine and later artemisinin revolutionized treatment, but resistance remains a challenge. Despite efforts like insecticide-treated nets, vaccines, and global eradication campaigns, malaria still kills over 600,000 people annually, proving that this ancient enemy remains a modern threat. In 1770, Moscow faced one of its deadliest crises, the Moscow Plague. This outbreak of bubonic plague, likely brought from Ottoman territories during the Russo-Turkish War, spread rapidly through the city, plunging it into chaos. The first cases appeared in the summer, but by early 1771, infections surged, overwhelming the city's medical facilities. Fever, painful swollen buboes, and blackened limbs marked the afflicted, while terrified residents abandoned their homes, leaving corpses in the streets. Quarantine measures were imposed, but they only fueled public outrage. Economic hardship and food shortages worsened the crisis, leading to the infamous Plague Riot of September 1771. Enraged citizens, blaming government officials and doctors, stormed hospitals and murdered Archbishop Ambrosius, who had ordered churches to close to prevent gatherings. By the end of the year, the plague had killed nearly 100,000 people. It only subsided when Empress Catherine the Great sent military forces to enforce stricter measures, marking one of Moscow's darkest historical tragedies. The Third Plague pandemic, lasting from 1855 to the mid-20th century, was a century-long outbreak of bubonic plague that began in Yunnan, China. Spreading along trade routes, it reached Hong Kong in 1894, where scientists first identified Yersinia pestis as the disease's cause. From there, steamships carried the plague to India, where it killed over 12 million people, making it one of the deadliest pandemics in history. Unlike past outbreaks, this pandemic wasn't just bubonic. It also included pneumonic and septicemic forms, which spread through the air and bloodstream. The British colonial government in India imposed strict quarantine measures, sparking riots as people resisted forced evacuations and sanitation efforts. Meanwhile, the disease reached port cities worldwide, establishing new plague reservoirs in rats and fleas. The pandemic finally waned due to improved sanitation, antibiotics, and pest control. Though it never fully disappeared, the third pandemic led to breakthroughs in plague research and the development of modern public health strategies. The swine flu pandemic of 2009, caused by the H1N1 influenza virus, emerged unexpectedly and spread rapidly across the globe. First detected in Mexico, the virus combined genetic material from swine, bird, and human flu strains, making it highly transmissible. By June 2009, the World Health Organization declared it a pandemic as cases surged worldwide. Unlike typical flu outbreaks that primarily affect the elderly, swine flu disproportionately impacted children, young adults, and pregnant women. Symptoms resembled seasonal flu: fever, cough, sore throat, body aches, but some cases led to severe pneumonia and respiratory failure. Governments rushed to develop and distribute vaccines, while antiviral medications like Tamiflu were widely used for treatment. Though initially feared to be as deadly as past flu pandemics, swine flu turned out to be relatively mild for most people. By August 2010, WHO declared the pandemic over. However, the virus continues to circulate as a seasonal flu strain, reminding the world of influenza's unpredictable nature. The Ebola virus, one of the deadliest pathogens known to humanity, causes a severe and often fatal hemorrhagic fever. First identified in 1976 near the Ebola River in the Democratic Republic of Congo, the virus spreads through direct contact with bodily fluids of infected individuals or contaminated objects. Unlike airborne diseases, Ebola relies on close human-to-human transmission, making outbreaks devastating but somewhat containable. Symptoms begin with fever, muscle pain, and fatigue, quickly escalating to vomiting, diarrhea, internal bleeding, and organ failure. Mortality rates can reach up to 90%, depending on medical intervention. The largest outbreak occurred in West Africa between 2014 and 2016, claiming over 11,000 lives and overwhelming healthcare systems in Guinea, Liberia, and Sierra Leone. Efforts to combat Ebola include strict isolation protocols, experimental treatments, and the development of an effective vaccine, Ervebo. While outbreaks continue to appear, improved global response strategies and medical advancements offer hope in controlling this deadly virus.